The following is a presentation of WGN News.
Right now, my mother is still in a medically induced coma. She's all that we have.
I just cried and held his hand. I didn't want to accept the fact that that would be the last time that I would see him alive.
It's the saying, if white people catch a cold, black people catch pneumonia.
Generations of systemic disadvantages in communities of color are now amplified in this crisis.
We're nurses, and our attitude is to help. Maria exemplified that.
Good evening. I'm Micah Mater, and thank you for joining us for this critical conversation about the COVID-19 divide.
And I'm Lourdes Duarte. While Chicagoans are coming together to get through this time in history, some are contracting the virus at a much higher rate.
Yeah, the numbers paint a picture of the impact COVID-19 has had on communities of color.
Follow along as we show you the top 5 zip codes in the state with the most confirmed cases. All of them are in Cook County. All of them are large Black and Latino neighborhoods. Brighton Park, for example, on the west side of the city, has more than 2,000 cases.
Similar story for Little Village, just north of Brighton Park. In the last few weeks, both of these neighborhoods have seen an increase in the number of confirmed cases.
Also in Cicero, hit hard. The Village sits just outside of Chicago, but still in Cook County. The City View Multi-Care Center, a nursing home there, made headlines last month with nearly 250 confirmed cases and so far 10 deaths.
And on the north side of Chicago, the Belmont, Craig, and Hermosa neighborhood also makes up the top 5 zip codes.
And finally, West Lawn has more than 2,500 confirmed cases. You can see in Chicago, Black and Latino communities make up 75% of the cases. Deaths linked to COVID-19 affected the Black community most, with 76% of the reported deaths.
Tonight, we're going to talk to the people who have feet on the ground in Chicago's fight against COVID-19, from the communities where the battle's claiming the most victims. Medical and health professionals say at the same time they're scrambling to meet those communities' urgent needs. They're working to overcome a legacy of obstacles.
The COVID-19 virus is hitting minority populations in Illinois particularly hard, especially in Chicago.
Overall, 60% of our deaths remain in the African American community.
COVID-19 is hitting Illinois' Latino community especially hard.
Chicago's minority community has been beset with healthcare disparities for centuries. So what's happening now isn't much of a surprise.
The numbers continue to make national and international headlines, with Chicago's Latino and Black residents topping the count for COVID deaths in Cook County. Emergency room Dr. Jeffrey Sterling is the founder of SIMCO, the nation's first managed care organization. He says before the problem can be fixed, it must be acknowledged.
If you're actually interested in promoting a level playing field, you have to appreciate that healthcare disparities actually exist, and they're reflected in many ways.
The game changer in many instances is what's known as comorbidities, illnesses and pre-existing conditions that make it more difficult to recover from an already potentially deadly infection like COVID-19. To people who would say other races suffer from all those same conditions, Dr. Sterling says there is a difference.
There's an additive effect because African American and other communities of color tend to have more comorbidities, and the levels of disease that exist in these communities tends to be more advanced.
Sterling says some of that is the result of the lack of access to preventative care.
One thing that doesn't get discussed enough is that there are still 20 million Americans who don't have health care.
For many disenfranchised communities, the only time those residents see a doctor is in the ER.
I've been an emergency physician for about 25 years now, and we see people who come to the ER when they've gotten some disease like COVID-19, and they're invariably worse off. That's the case not because of choice, but because of happenstance.
You know, there's some people that have tried to blame Black and brown communities around, why the disproportionality is seen in these cases. And that's simply not true.
Lieutenant Governor Juliana Stratton says many of the very services keeping the city moving are being performed by the people suffering the greatest.
There's some studies that show close to 80% of people of color cannot stay at home because we're on the front lines in grocery stores and driving the buses and delivering the mail and working in hospitals at every different level.
They sometimes threaten employees that they need to come back to work, and so they're torn between doing the right thing and taking our advice to stay home or potentially lose their job.
Esther Corpus is the CEO at Alivio. founded 30 years ago to serve Chicago's undocumented Mexican community.
They don't always understand that when they get the test, they think they can go back to work and wait for the results. But we follow the CDC guidelines, and if they're being tested, then they can't go to work until we get the results back. And that causes a lot of issues with employers. We're finding that we're writing a lot of notes for employers and really mandating that they allow these individuals to not go to work if they're positive or if they have symptoms. As healthcare providers, we're having to support them in making sure that employers are treating them fairly.
And there are other concerns specific to many in immigrant households.
Our community lives in closer quarters where it's very difficult sometimes to social distance. And so what we see is if one of them becomes positive, then the family becomes positive because it's virtually impossible for them not to come in contact with each other. You'll have la abuela, the mother, the children, everybody living in one apartment or in one building and taking care of each other because we don't traditionally put our elderly into nursing homes. We keep them close to us and we care for them.
For some, the issue is trust. As the world scrambles to produce a vaccine, last month reports started circulating that Africans were being used to test it. Those reports were unfounded and untrue, but it struck a chord because there is a history of people of color being misused by medicine. In the 50s, the world's first birth control pills were tested on a group of women in Puerto Rico. The women were simply told they would be kept from getting pregnant. They'd not been told they could die. 3 did. And for African Americans, the stories are unfathomable.
The implied contract between the medical, scientific, and research communities and the Black community has been broken, and it's been broke since its inception. As soon as we got to the States, we weren't subject to any type of equality in healthcare. We were only counted as 3/5 of an individual once that even became a thing.
And then there's Tuskegee.
Those were a series of experiments done by the federal government in which African Americans were tested to see the ongoing evolution and outcomes of untreated syphilis.
The Tuskegee experiments were conducted from 1932 until 1972. In 1997, President Bill Clinton issued an apology on behalf of the United States.
What was done cannot be undone, but we can end the silence.
For many undocumented Chicagoans, fears of losing everything they've worked for are keeping them from seeking help. Earlier this year, the United States Supreme Court lifted a statewide Illinois injunction against what's known as the public charge rule. It means that anyone seeking citizenship or a green card on or after February 24th could have their application denied if they use public benefits, with the idea being that they're costing the country money.
It has affected our community greatly. We have seen folks, dropping out of federal programs such as Medicaid, which is horrible for our children who, need to be immunized, especially when you think about COVID, immunizations are really important.
So even once the programs intended to help those in need are in place, many immigrant Chicagoans seeking citizenship avoid them.
They just won't access services if they think that it's considered a public benefit that will prevent them from their pathway to citizenship. And so that's, again, another barrier that we face.
This is what structural racism looks like.
Natalie Moore is the author of the critically acclaimed book, The South Side, A Portrait of Chicago and American Segregation.
All you have to do is drive around the city, get out of your own neighborhood. And why do certain North Side communities look different from certain South Side communities? What you're visually seeing is the disinvestment. Fewer stores, fewer amenities, fewer opportunities. All of that again goes back to the built environment, and the resources are just totally imbalanced in this country, in this region, in this county, in this city.
Thousands of Chicagoans are recovering, but COVID-19 is shedding light on what's known as a death gap. It's the difference in the numbers and more often the neighborhoods where you're more likely to live or die. As you're about to hear, many of the factors that determine that have nothing to do with illness at all. There's a whole lot more to talk about.
Poverty itself is a thief and steals years of life expectancy from people. I'm David Ansell. I'm a physician at Rush. I'm the Senior Vice President for Community Health Equity at Rush University Medical Center. My work has been largely trying to understand why some people in the city of Chicago live longer than others. The field is called health equity, and I've studied what I call death gaps. If you live in the Loop, can live to be up to 85, 90 years old in some neighborhoods in the Loop. But you take the Blue Line 7 stops west to Garfield Park, and life expectancy in some neighborhoods overall in Garfield Park is under 69 years old. The causes for this are not just people's beliefs, behaviors, and the biology or genetics. It really has to do with the neighborhoods themselves and something that is called structural violence. And it's structural because the policies and procedures, how the schools are organized, housing, access to jobs, are structural conditions, and it's violent because people die prematurely as a result. It's unnatural, it's unjust. Black people, Black neighborhoods all across America, it's not just Chicago, all across America, have been made the most vulnerable. So it's not a surprise that when an epidemic comes, which we call an equal opportunity epidemic, except it's not, it wasn't a surprise that Black people were affected more. And now also in the Latinx community, we're seeing a terrific outbreak and high mortality there, because all that an epidemic does, people may remember the Chicago heat wave, which was a heat epidemic, or Katrina, which was a hurricane. All that these events do, happens to be a virus, peels back the covers of our society and reveals those social fault lines. And in the United States, and particularly in Chicago, that's at the intersection of race and poverty. Each one of these deaths, as a doctor, that you know is preventable, is really, really painful. And we think about these stimulus packages that are going to bail out the airline industry, that are going to bail out businesses that had to lay off individuals. They're all really important. But we need stimulus packages to bail out these neighborhoods that have been literally oppressed for generations. We've all watched this go on too long. We are being handed these opportunities over and over again to finally get it right. And I hope this time we can finally get it right.
Years and years of inequities. Well, after